Thank you very much. Good morning. In the next 5 minutes, I'm going to present the main results of this clinical trial, the confirmed clinical trial, that was a phase 3 clinical trial comparing two different doses of fulvestrant in menopausal patients with estrogen receptor positive advanced breast cancer. This is the study design. 736 patients participated into this clinical trial. They were all menopausal, all with advanced breast cancer and estrogen receptor positive tumors. Here you can see the two different doses of fulvestrant, the standard dose, 250 milligrams, and the experimental dose, 500 milligrams. It was a placebo-controlled trial, so patients on 250 received also a placebo injection. These are the results that we presented here in San Antonio 3 years ago regarding the progression-free survival analysis of this clinical trial. And as you can see, at that time, we showed that fulvestrant 500 is superior to fulvestrant 250, and this superiority is also statistically significant, with the hazard ratio at 0.80 and p-value of 0.006. At that time, we presented also the overall survival analysis. Results are reported on this slide. This survival analysis was presented when 50% events had already occurred. So 50% of patients had died at the time of this survival analysis. And here we had a numerical superiority of 500 milligrams over 250, but this superiority did not reach statistical significance. So based on these encouraging results, we decided to perform a second survival analysis to be done when 75% of patients had died. And today we are presenting the results of this second survival analysis done at 75% maturity. And here you can see the results. We continue to see a numerical superiority of 500 milligrams over 250 milligrams. The hazard ratio is 0.81. The p-value seems to be statistically significant, but please note this is a nominal p-value because this was an exploratory analysis. We didn't have enough statistical power to perform here a formally statistically valid analysis and comparison between the two different study arms. I think, however, that it's interesting to highlight the concept that the two survival analyses are perfectly consistent. You can see at your right the 50% events analysis, and at your left, at your right you see the 75% events analysis, and at your left you see the 50% event analysis. And the two analyses, as you can see, are leading to the same conclusion, and the conclusion is that there is an increased benefit in terms of survival for patients receiving 500 milligrams. In terms of safety, this second analysis did not show any relevant information compared to the previous analysis. No differences in terms of serious adverse events between the two treatment groups. Here we have a list of serious adverse events with outcome of death. As you can see, we had very few events in both study arms, 5 events for 500 milligrams and 7 events for the 250 milligrams. So overall, there is now clear information regarding the lack of increased toxicity when you increase the dose of fulvestrant from 250 to 500 milligrams. So in conclusions, this final overall survival analysis performed at 75% maturity showed that fulvestrant 500 milligrams is associated with a 4-month increase in median overall survival and 19% reduction in the risk of death compared with fulvestrant 250 milligrams. These results are consistent with the previously reported progression-free and overall survival results that we reported a couple of years ago in the Journal of Clinical Oncology. The safety results of this clinical trial do not support any clinically relevant difference between fulvestrant 250 and 500 milligrams, and they are consistent with the previously reported safety profile for fulvestrant 500 milligrams. So based on these results, we believe that whenever the clinician is planning to use fulvestrant for the treatment of ER-positive advanced breast cancer patients in menopausal status, well, the dose of 500 milligrams should be considered as the recommended dose. Thank you for your attention.
Okay, we're going to have all the questions at the end, of course.